Okay, well, welcome to our the third in our Sydney Southeast Asia Centre webinar series focusing on health. We're coming to you live through Zoom this evening or this morning if you're in Europe, and we're also streaming live through Facebook through the Sydney Southeast Asia Centre's Facebook page. My name is Dr. Natalie Pearson and I work here at the Sydney Southeast Asia Centre. And before we get underway, I would like to acknowledge that I am joining you from Gadigal land and that this land belongs to the Gadigal people of the Eora Nation. I'd like to pay my respects to the elders past and present. We have a really fantastic speaker joining us today, a good friend of SEAC, in fact, Associate Professor Navneet Dhand from the Faculty of Science. And Navneet works in veterinary biostatistics and epidemiology. I just love the title of your talk, Navneet, Training Animal Disease Detectives in the Asia Pacific to Prevent the Next Pandemic. And I can't wait to find out who or what these animal disease detectives are. So Navneet is going to speak to us for about 30 to 35 minutes. And after that, we're going to have a question and answer session. So if you do have any questions about the presentation, please feel free to enter them into the Q&A box at the bottom of your screen. You can also raise your hand at the end of the presentation, or if you're joining us through Facebook, just pop a question into the comments section and we'll feed it through to Navneet at the end of his presentation. So without any further ado, I'll hand over to you, Navneet, to introduce us to training animal disease detectives in the Asia Pacific. Thank you.
Thank you. Thanks, Natalie, for the introduction and for inviting me for this talk. And thanks, everyone, for joining for this webinar. Before I start, I would like to acknowledge funding from FAO and DFAT for the work that I'm reporting in this talk. So I will briefly talk about emerging infectious diseases and why and how field epidemiology training is important to tackle them. And then I will discuss the work that I have done with the FAO in the past few years in this space, and then followed by the work that we are doing currently in Southeast Asia based on funding from DFAT for the EPCO project. So emerging infectious diseases are infections that have recently appeared in a population, or whose incidence or geographic range has increased. WHO has warned that the infectious diseases are increasing at a rate that hasn't been seen before. In the past about 40 years, since 1970, we have seen several outbreaks of emerging infectious diseases, including SARS, Ebola virus, avian influenza, swine flu, and now COVID-19 and many others. So why these diseases are emerging? The diseases are emerging due to confluence of several factors, including increasing population and urbanization, and causing deforestation and exploitation of wildlife. So as the population increases, so does the need for housing and food for them. And to meet that demand, we are clearing forests and which brings our domestic animals and humans into close contact with wildlife, which results in transmission of infections from wildlife to domestic animals and then to humans. In addition to that, we to meet the demand for food, we have resorted to intensive farming systems, which are great to meet the demand for protein. But this is also good for pathogens because it is much easier for them to transmit from one animal to the other when the animals are in congested environments. And we are also aware of the issues with wildlife, wildlife trade and exploitation due to for use as food, pet animal or food, or for traditional medicines. And all of that brings, again, animals and humans into close contact with wildlife, which is a recipe for disaster, I guess. And in addition to that, when the diseases are in humans, then it's easy to transmit and spread around the world through international travel, as we have seen with COVID-19. So it has been investigated and reported that more than 75% of these diseases they originate in animals. So about 60% of the existing human diseases are zoonotic, when more than 75% of the emerging infectious diseases of humans have an animal origin. So what usually happens is that the diseases spill over from wild animals to domestic animals, and then they cause some outbreaks in them. And then from domestic animals, usually they spread it to humans, causing outbreaks in humans. And as we have seen with COVID, originally the virus spread from bats. We don't know through which animal, but through some intermediary animal that spread to humans, and now it is transmitting between humans. Sorry. So that's the story that replicates in most of the diseases, emerging infectious diseases. Take this example of Hendra virus in Australia. If the flying foxes are the reservoirs of the virus, paramyxovirus, and spreads from flying foxes to horses, and then spreads from horses to in contact humans. And the first outbreak occurred in 1994, but we have seen several outbreaks since then that has affected more than 100 horses. And similar outbreaks of Nipah virus in Malaysia and Singapore occurred in 1999 when bats roosting on mango trees near a pig farm, they spread infection to pigs, and then from the pigs, the infection spread to in contact people. And that killed more than 100 people, and then more than 1 million pigs had to be culled. Similar stories with avian H1N1 influenza or bird flu, where the wild birds are the reservoirs of the virus, and then it spreads to domestic poultry, and then it spreads to humans. And there was a severe outbreak in 2003 affecting several countries in Southeast Asia, including Vietnam, Cambodia, Indonesia, Thailand, Myanmar, and many other countries. And same is the story with the SARS, which spread from bats to civet cats and potentially through civet cats and to humans, and affected more than 8,000 people at that time, causing more than 700 deaths, but affect in 26 countries. So same story with swine flu, where these pigs act as mixing vessels, and they then spread virus to humans, and then resulting in human to human transmission later on. So as you can see that in all of these cases, the virus originated from wildlife and then spread to domestic animals or other wildlife, wild animal, and then spread it to humans. So the key question is that if we know that a majority of these emerging infectious diseases have an animal origin, then what can we do about them? So what is the best way to protect people from these diseases? So if we know that the diseases are originating in animals, then I guess the best strategy is to detect and contain them at this animal source before they are able to spread to humans. So detect them in their wildlife source or at the interface between the wildlife and the domestic animals. But what we are trying to do these days is we are trying to control emerging infectious diseases after they emerge in humans. And as we have seen with COVID-19, they can cause huge impact. So we have COVID has everybody knows that has affected 140 million people, which the number doesn't mean sometime anything, but it is 5 times the population of Australia. So the idea is that if you want to protect humans, if you want to protect humans, then you need to tackle emerging infectious diseases in animal populations instead of focusing entirely on humans. So how can we achieve that? How can we detect early infectious diseases early on in animal populations? And what do we have to do? And that's where this work comes into picture. So we have to train the animal health workforce to become animal disease detectives or field epidemiologists. Right. So the field epidemiology training programs for veterinarians have been running in several countries, and they train veterinarians to conduct disease surveillance and outbreak investigation. So surveillance is like to make sure that we detect the diseases early on before they are able to spread. And outbreak investigation is, of course, to contain the spread of the outbreak or mitigate the risk. Take the analogy of the police force. We train our police force to conduct surveillance so that they can detect criminals and terrorists before they are able to commit the crime, but they also know how to deal with the situation if a crime is committed. So the same way, the field epidemiology training programs they train veterinarians in disease surveillance so that they can detect diseases early on before they are able to spread to human populations or to other animal populations. But they are also trained in outbreak investigation so that if outbreaks happen, they should know how to contain them, how to control them. And I have been talking mainly about emerging zoonotic diseases spreading from animals to humans, but the same skills are all same critical for animal diseases as well. So we know that African swine fever killed 1/4 of the world's big population in 2019. It spread from one district in China to many of the countries in Southeast Asia. And you can imagine the impact on farmer livelihoods and food security due to this disease. So the field epidemiologists are not only great in tackling emerging infectious diseases that spread from animals to humans, but these skills are equally useful for tackling transboundary animal diseases or other endemic animal diseases. So field epidemiology training programs, just to give you a bit of history, they started by US CDC in 1950s to train nurses and medical doctors in investigating outbreaks and conducting surveillance. And they became so popular that they are now running in more than 70 countries. And as usually happens, the veterinarians also started their own training programs following the same approach. And the programs in animal health were started mainly in Southeast Asia in association with the avian influenza outbreak. So to train veterinarians to tackle the disease, to control avian influenza, the FAO started training veterinarians and para-veterinarians in outbreak investigation and surveillance, and that took the form of eventually field epidemiology training. I will talk about my involvement with this work. Now, I have been working with the FAO since 2015 in this field epidemiology training program. So when they when they asked me to organize a workshop in Arusha in Tanzania on field epidemiology training, and then followed up with another workshop in Kenya in 2016. So that the workshop involved veterinarians from 4 East African countries in Tanzania, Kenya, of course, but also Uganda and Ethiopia. So these trainings, after these trainings, then FAO organized some 2 workshops in 2018 in Rome. So the first workshop in February 2018, involving about 70, 80 people from around the world to take stock of the situation, to see what other people are doing in field epidemiology training, and to learn lessons from their experiences. And then they invited a smaller group in July 2018 to do some hands-on work to prepare the to identify the competencies and to work towards preparing the curriculum. And after that, they signed an agreement with the University of Sydney to with the three objectives: to review the existing program, so basically to put together our learning from the workshops, but also we interviewed um, program managers from several countries. So to review the programs and to identify core competencies and develop a FETPV curriculum and develop guidelines if a country wants to establish a new program. So all of that work has now been done. So Laura did a great job in reviewing, conducting that review, which is working with me. So the review was mainly done in Southeast Asian countries, but she also interviewed people from outside the region. The field epidemiology program, just as I said previously, they started mainly in association with the avian influenza outbreaks in early 2000s, but then they formally established a program in Thailand called Thai Regional FETPV in 2009. And they have trained people from several countries in the region. And this is one of the biggest training program in our region. Around the same time, then Philippines also started training their own veterinarians in their field epidemiology training. Their program has undergone several changes since then, and currently it is a tiered program with 3 levels. And around the same time, Vietnam started its own AVIT program, and that has 3 weeks of classroom and 6 week of a field project. China joined the bandwagon in 2010, and that's a 2-year program. In addition to that, they also have an executive training for their animal health leaders. Cambodia started the program in 2012. It's a 5-week basic epidemiology training, and could also undertake 6-month extended course. Indonesia started their PELVI program in 2018. It's a 1-year program, but the participants can also join a university to undertake a master level course if they want to upgrade their skills. So as you can see, the one thing that we realized after reviewing these programs is there is a lot of variation in quality and standards, not only in the duration, but also in the skills that the partners, the trainees achieve. So if the problem is that if somebody tells you that I'm a field epidemiologist, then you don't know what kind of skills they would have. So that's the main thing that came out of that review. But also the program managers advised us that there is unavailability of suitable learning materials and case studies. So this is an applied program, and case studies play a major role in field epidemiology training. While they are available for public health field epidemiology training for doctors and nurses, the case studies are very limited for animal health training. And particularly if they are available, they are based on developed country settings. For example, the beef farm in Australia, which is in a completely different situation compared to a backyard farm in Indonesia. Other issue that came up is that there is a limited opportunity for upskilling facilitators and mentors. So facilitators are people who train field epidemiologists, and mentors are people who supervise their projects. So they work in their ministries, and they don't have any further opportunities to upskill themselves. And this came up in the FAO workshops as well as in the review that we have conducted, that we want our trainees to achieve applied skills, but the teaching method that they're using are quite old, basically lecture style, and there is that doesn't align with the outcomes that you want to achieve. And this is another limitation that came up, that difficult for veterinarians to work with their public health colleagues, which is then funding and sustainability, of course, was another issue. So that was the first objective of the FAO project. The second objective was to identify core competencies and develop a curriculum. And that has been also completed and submitted to the FAO. The curriculum, we created a structure sort of based on the the CDC program, but also including the differences in animal health programs than from public health programs. So our frontline program that we proposed is a 4-week in-class or field activities and followed by 3 months of on-the-job projects, and the intermediate program with 12 weeks and 6 months. And the advanced program is similar to a master's. We haven't done a lot of work on it yet. It is we have yet to be approved, but we are mainly focusing on the frontline and the intermediate programs. And we have developed their competency to identify the competency domains in the workshops, and then later I expanded them to create subdomains for each competencies and the learning outcomes for under each domain, both for the frontline as well as the intermediate programs. And that curriculum has been submitted, and hopefully that will provide some sort of standards for these field epidemiology programs. And the third objective of the FAO project was to develop guidelines if a country wants to establish a field epidemiology training programs. And the guidelines have also been submitted now to the FAO. And these are the people who attended the second workshop. They made a lot of contributions. So I drafted them, but all of these people contributed extensively to the development of these guidelines. So the plan, FAO's plan, is to publish these guidelines for their member countries in several languages, so that if a country wants to establish their own field epidemiology program, they can use this as stepwise approach including the curriculum, and so that they can establish a standardized program. So with the submission of these reports, I guess the first problem that we had identified is largely solved, but there's more work needs to be done. But we have tried to sort it out, as we now have the curriculum as well as the guidelines for establishment of a program. But the remaining gaps that we had identified in the review, they still remain. And then I saw a call for funding applications when I was actually in Indonesia organizing a workshop, and I saw that, and I thought we should apply for funding to fill some of these gaps. And we then later put together, I talked to my colleagues in different vet schools, epidemiologists, and we submitted a bid that was successful. And we have established that Asia Pacific Consortium of Veterinary Epidemiology, involving 8 countries in Southeast Asia. And our actual project involves 11 countries, including the Pacific countries. But our sister project at CSU, they are focusing on the Pacific countries for strengthening the capacity of paraveterinarians. And the Asia Pacific Consortium of Veterinary Epidemiology, we are focusing mainly on Southeast Asian countries to strengthen their epidemiology capacity of the veterinary workforce. And I was fortunate to get interest and engagement from all veterinary schools of Australia and New Zealand, and 1 veterinary schools in the US. And they also have a lot of interest and experience in field epidemiology training in South America. So we have these universities involved, but also there are people, representative from these international organizations in the advisory board, and members from each of the target country in our consortium. So the project was funded with these 4 objectives. Broad objective to pretty much based on the gaps that we had identified in the FAO project. So as I mentioned that one of the issue was the unavailability of suitable learning materials and case studies, and that became our main objective to develop 30 learning modules and case studies. So we are now currently in the process of developing these modules and case studies on outbreak investigation, on surveillance, risk assessment, disease control, One Health and biosecurity, and leadership and communication. The number has gone up a little bit since I prepared this presentation, but essentially we are working on these 5 competencies. To develop these modules, we organized 4 workshops last year where we invited our partners to present ideas about developing these modules, finalize the learning outcomes for these modules, and to brainstorm ideas for making these modules relevant for our country partners in Southeast Asia, but also to make them interesting and engaging. And that work is now progressing, and we hope to complete the development of these modules by the end of this year. So the difference of, the many other universities and organizations have created some online training, but this would be, once it is completed, this would be the biggest and most extensive field epidemiology training resource worldwide. And we want to make sure that it is available online after the project is completed. Anybody from any part of the world would be able to access this. The second beauty of this work is that this is not done by a single or 1 or 2 lecturers in a university, and these modules are being developed by 48 people from 8 target countries, but 9 universities, and with the help of our advisory board. So the expertise that is in the consortium is enormous, and I'm very fortunate to have their input, and they're bringing in their experience and expertise to develop these modules. All right, so the second objective of the project was to train animal health workforce in the target countries. So using these modules, we will enroll 20 veterinarians from each country and ask them to undertake our modules. And of these 20 veterinarians, we will select the top 5 and then provide them funding to conduct hands-on projects under the guidance of a mentor, and then select 1 trainee for further training in Australia. And that work is starting now. We are calling for the expression of interest and that's due by 15th of May. So of course, we are training these veterinarians, but the other objective of this work is to investigate whether this pedagogical approach of using an online resource that is present, available centrally, combining that with the training within each country, hands-on training within each country, could that work? So if this is successful, that a centralized resource combined with hands-on training in each country, if that is successful, then it will be much easier to expand this program to other countries where there are no existing field epidemiology training programs, or their rudimentary training programs. Right. The third objective of the project is to conduct workshops for field epidemiology training for facilitators and mentors. And as I mentioned that the program managers advised us that they had limited opportunities for upskilling their facilitators and mentors. And this came up in our workshops that the teaching methods are quite old. And to fill these gaps, we decided to conduct workshops for training facilitators and mentors. So we are planning 4 to 5 workshops on pedagogical methods, on developing case studies, So we are developing case studies in our project. What we want to do, make sure that the people that we train, they continue to develop these case studies based on their own scenarios after the project is completed. So we want to develop these case studies, but we are also training them so that they can continue this work. And because a lot of this work is mentorship and leadership, so we are also training them in these as well as in One Health. So these workshops, some of these workshops had to be changed to online format, but we are hoping that we would be able to conduct some of the workshops face-to-face next year. So the pedagogical methods workshops follows on from the work that I have done with the Indonesia in the past couple of years. So we received some funding from DFAT to for the same problem, that the teaching methods of epidemiology for teaching epidemiology are quite old. So we organized 2 workshops, one in Indonesia and one in Sydney, where we trained the facilitators and mentors and epidemiology lecturers from 2 universities in teaching methods. And that those workshops were quite successful, and that's why we included that. So that was included that component in our larger project, EFAT funded project. So considering this as just a pilot in Indonesia. And the last objective of this project is to then establish a regional network of FETPVs to make sure, because one of the problem was sustainability. So we will develop these resources. What will happen to these resources after the project ends? So we will develop a network so that all the resources and all the e-learning modules and case studies are available on that network. And all our trainees that we train in this project would be able to communicate with each other, network with each other. And also we would give them an opportunity to share their materials and resources so that this work sort of continues once this project ends. So hopefully by the end of this project, we will have filled most of these gaps. There's a lot more work to be done, but hopefully that will enable us to train our partners in 8 countries for early detection, prevention and containment of emerging infectious diseases, and hopefully doing our bit for preventing the next pandemic. Thank you very much. And this is our consortium team. I think we have most of the people there, but I may be missing some. Thanks. Thank you very much.
Thank you, Navneet. That was fantastic. That is a huge team you've assembled there, and I was also very impressed to see with your Zoom, your now ubiquitous Zoom screenshot that almost everybody had turned their camera on for the photo. It's really impressive, this network that you've managed to assemble.
Thank you.
And we do have quite a few questions coming through. So if it's okay with you, I'm going to go straight to the questions that are coming through.
Yeah, can I stop sharing my screen or?
Yeah, if you'd like to, that's fine.
Yeah.
So the first question that I'd like to ask you is about cultural practices and rituals in Southeast Asia, and whether you've encountered any difficulties getting biosecurity health practices applied when there are these sort of local cultural practices regarding, for example, animal sacrifices for funerals or weddings or other religious ceremonies.
Yes, that's a really, really good question, and this is on our mind. So the the work that I have done in the past, I started with the equine influenza outbreak. I had a project on equine influenza in 2007, and we realized early on in that project that we can talk about all the technical skills, but things don't work out as we think they would work out, because if the biosecurity, for example, is implemented by humans, not by robots, right? So I realized at that time, and then we decided that we need to involve social scientists and psychologists in our projects. And that's what we are trying to do in this one. We will be involving social scientists and psychologists in some of these workshops in on leadership training as well as mentorship training, and to discuss how, so these are the people who will be then dealing with that situation. So the idea is to that develop their leadership skills so that they are able to deal with that situation. But considering that it takes much longer to change human behavior. So human behavior, is um, easy to say, but we for example, we know that smoking is injurious to health, but still many people smoke, and we government have been asking us to wear masks and do everything, but we have been engaging in risky behavior. So people make their own decisions about these risky behaviors based on their risk perceptions, their culture, and their social upbringing and background. And as I said, it is difficult, not easy to change that. But the way forward on that is to involve social scientists in the work, and that's what we are doing. So we are trying to make sure that we involve social scientists in our One Health training as well as in leadership training.
Yeah, and I think Justin Beardsley, who was our speaker last week, also engages very closely with this One Health approach. And it's, this interdisciplinary approach is something we really encourage at the Sydney Southeast Asia Centre. So the next question is also, I guess, about sensitivities, not so much cultural sensitivities, but more so political sensitivities. And it's about how sensitive governments in Southeast Asia are to biosecurity issues. You've got a really international team working in the Asia Pacific. Are there fears or suspicions that are held when it comes to foreigners coming into Southeast Asia, investigating these issues, particularly within the context of the WHO's work in China in relation to COVID-19?
That's again a really good question. So I think it is a matter of trust. So I did a lot of work before we submitted the proposal, and that was one of the reasons I was told when the project was successful, that why they selected our project out of 72 or something that were submitted. I talked to all the country partners in the ministries and the universities in all of the countries before we submitted the project. So we, at the time of submission of the project, we had already discussed our project approach with them. And when we developed our project proposal, taking them into confidence. And at the time of submission, we had letters of support from all of the target countries. And from many countries, we had letters of support from universities as well as the animal health ministries. So it is an important issue. Definitely, you have to develop trust. And what helped in our situation is that many of our partners in Australia or New Zealand, they have been working in these countries for several years. For example, I've been working with Indonesia for about 8-9 years now in aquatic animal health projects, but also in other projects. Many of my colleagues have been working in Myanmar, in Vietnam, for example, people from Melbourne. So those relationships have helped quite a bit in developing that trust. The one thing that hasn't helped is the COVID pandemic, because we couldn't actually visit and talk to them as we had planned. And the other, as you know, the situation with Myanmar hasn't helped. So we are now investigating on what to do with the, how to deal with the situation, because we have received instructions not to go ahead with some of the work that we were doing in Myanmar. So there are challenges, of course, but I think the trust is the most important. And if you are engaging with our partners and not just coming as foreigners to do work there, but engaging with them and encouraging them to lead their own work. And that's basically what we are trying to do. We are not trying to conduct any outbreak investigations in their countries. We are trying to train them so that they become leaders in their countries.
Thank you, Navneet. That's a great answer. And I guess when it comes to this training, one of the questions we've got is about how much of the training is online. And that was a question I had as well in terms of accessibility. I think it's great that you are making those modules available online. One of the things you said is that you're trying to make them as engaging as possible. How are you doing that?
All right, that's a good question. So yes, we know, and that we had decided, this project was submitted in 2019 and was approved in 2019 before COVID happened. So, we had decided on this format early on before the COVID happened. The reason is that of using these online modules is that, we organize a lot of workshops. And in my experience, if you don't follow up, and then many of the resources and the skills get lost. So what we are trying to do is trying to develop a world-class resource of e-learning modules and case studies that will stay there after the completion of the project. And what we are doing to make sure that these are accessible, and we have done a lot of work to investigate that. So there are three ways people usually develop these modules, either by using videos or slide presentations or recording their lectures. What we have tried to, we are using a program that will create modules which flow like a web page, so they will, so that our users can use them on their mobile devices. So we are aware that not all of our trainees would have a desktop. So many of them will be, watching our modules or interacting with our modules on their tablets or even iPhones or smartphones. So we're making sure that the materials, the modules that we develop are suitable for mobile devices. We are also ensuring that no video that we create is more than 2 minutes, so that because many of these countries have problems with the internet connections and the download speeds. And we're also making sure that the overall sort of length and speed of the module is suitable for use on mobile devices.
Yeah, that's fantastic, because it does make it more accessible for farmers, for example. Yeah. But I did want to ask about the language of instruction. Is it English, or are you attempting to roll it out in local languages as well?
Yeah, we are very ambitious. So what we are trying to, if it is possible, we will translate into 7 languages. And that's a lot of work, and that's one of the reasons the program that we have selected for developing these modules, and that was another reason why we selected that program, because after we develop the modules in English, then that program allows us to download the file and then give that file to a translator, and then upload the translated file and then automatically creates an operated module in a different language. So we have tried that and tested that with one module, but with one language. And because we are early on in the process of developing modules, we have developed content for about a dozen modules, but we haven't started the online process of developing the modules. But if everything works as we planned, we want all of these 34 modules to be translated into 7 languages, so that they don't have to understand English as much as we think they understand. So but it is particularly important for some countries, not as important for some other countries. So we are seeing also with English, there is a lot of variation in between countries.
You discussed the AppCove project at the end, the Asia Pacific Consortium of Veterinary Epidemiology. I noticed that it doesn't include Malaysia, Thailand, and Singapore. Is there a reason for that?
Yes. So the DFAT asked for called for when DFAT called for projects, they called for projects for these countries. So there were countries that we selected, but then there were also countries in the Pacific that we didn't select because they don't have many trained veterinarians. So most of the animal health work in the Pacific countries is done by para-veterinarians. So another component of the project is working with them. So we didn't select those other 3 countries that you mentioned because they were not in the target countries in the call for applications.
Okay, that's a very straightforward reason that I understand. Now I know
we are working with Thailand though, and we have because the Thailand had the largest program in field epidemiology. We are closely working with them, and they are part of our advisory board.
Fantastic, thank you. We've got another question here about gender, in particular gender roles in farming and the different gender roles in farming in particular. To what extent is this a consideration in the development of the curriculum and the training?
Yeah, very good question. And that is quite important for us as well as the funding body. And we make sure that in whatever we do, we consider all the issues related to gender. For example, even in our consortium, there is a good representation of women, even in the leadership roles in the consortium. For example, the chair of the learning committee is a woman. And also in our, not only just in our consortium partner, but also in the target country partners, we made sure that we have both genders from each country involved. And that same thing we are going to do when we are selecting people for our training. We are going to make sure that we have a good representation of women from each country with constraints. And our project manager is actually quite particular about that. And she has done a lot of investigation about how we can make sure that women are able to attend our workshops and trainings, so that we organize our trainings in a way that because some women have to complete their household chores before they can come and attend a workshop. So she is trying to investigate what would be the best way for them to attend our workshop, so that the women are able to attend. So we are trying to do whatever we can within the constraints of COVID. We're trying to make sure that there is a good representation of women in everything we do.
On that topic of COVID, of course, COVID-19 is the #1 topic around the globe and has been for the past 12 or 13 months, even longer perhaps. How difficult is it to get funding and attention for this sort of epidemiological research within the context of COVID and before COVID? I mean, surely you've been ringing the alarm bells for many years. We've had many outbreaks, as you mentioned, the Hendra virus in Australia, swine flu, H1N1 throughout the region. Has COVID really brought this to the world's attention in a way that is beneficial for your research?
That's a good question, and we got this funding, much before COVID happened. Our project was funded in November 2019, about a month before. But you're right. This is a challenge. So particularly about One Health, there is a lot of discussion about One Health, about zoonotic diseases. The challenge is that, particularly in Australia, the way the funding bodies are structured, it's difficult to get funding for One Health or zoonotic diseases. The reason is that NHMRC provides funding for human health projects, and then ARC provides funding for some animal health projects. But then many industry bodies like Meat and Livestock Australia, they provide funding for livestock projects. But when it comes to projects that are about diseases that spread from animals to humans, they sort of fall through cracks because nobody is interested in funding them because that's not their main target. I think there's a need for establishment of an organization that by we talk about One Health, which is about breaking the silos, but our funding bodies also sort of live in silos. And when this project was funded, I considered myself to be very fortunate because our project was funded, but I have submitted previous projects that were, at least 2 projects to ARC that were rejected. And it's a lot of work to submit a project, but the reason what I'm saying is that it is difficult to convince funding bodies when their aims and objectives do not align with the work that you are trying to propose. And if the funding bodies are targeting human research on cancer, for example, I'm not saying that is not important, or diabetes, or then they are more interested in funding that work compared to work that involves animals and humans. But with COVID, what would that change? I think so. I think the COVID has increased appreciation of emerging infectious diseases and zoonosis, not only in our general public, but also in our decision makers, animal health policy makers, and funding bodies. In general, we have seen firsthand what is the impact of these diseases. We are talking about millions of people who are no longer living just in a year, and everybody had to live in lockdown. There was so much money that people lost jobs and livelihoods. There's a real impact, and if you do something about tackling these infections, you need to spend only a minuscule amount of money that we actually wasted in controlling COVID. And what this project is doing, we are sort of targeting the detection and containment part, but there is a lot of more work that needs to be done, even to prevent them from occurring, to tackle the real root causes of emerging infectious diseases that I mentioned. The way we are encroaching into wildlife areas, we're causing a deforestation, the climate change. So those big issues are not part of this project. We are including them in our modules in One Health and biosecurity, but there's a lot more work that needs to be done on that scale, on bigger scale, to tackle those issues so that we actually prevent these diseases from occurring. What I'm trying to do in this project is to detect them and contain them, but more work needs to be done for prevention.
Yeah, that's absolutely right. And so many of those drivers that you mentioned at the beginning of your presentation in terms of deforestation, wildlife exploitation, transportation, urbanisation, and housing, exploding populations, these are all factors that we see in Southeast Asia. So I think your point about how the funding models are siloed when it comes to funding in an Australian context, at least. So you mentioned the NHMRC, which is designed to fund research into human health, and the ARC, the Australian Research Council, which is for sort of everything else. Perhaps this project and the funding that you received even prior to COVID might be a sort of model for the future about how future research might unfold in this space between animals and humans, because they are becoming increasingly entangled and the implications are, as we've seen, so serious.
Yeah, absolutely. And there is a lot more work that needs to be done. So we are focusing on the field side of things to strengthen field epidemiology capacity. And there's an enormous amount of work that needs to be done to strengthen the lab capacity. And both of these components, work together. So if you collect samples from the field and there's nobody to test them, that's a problem. And if there is a good lab and there is nobody to submit those samples, that's a problem. So there are other projects that GFAT has funded that are working in that space of strengthening lab capacity. But and then we also need to strengthen the system. So we are training the workforce, but in many countries there are the surveillance system, for example, are quite weak. And there's more work that needs to be done in that space. One example is the work that Associate has done in Indonesia in developing a surveillance, mobile-based surveillance system. I think that needs to be sort of replicated in other countries. There's a lot more work needs to be done. Most of the funding so far has gone into tackling on human problems, as I mentioned before. So there's a lot more need to work on the animal side of things.
I'm aware there's also a lot more work that needs to be done when it comes to grappling with the bureaucracy of working in multiple countries with live samples. But perhaps that's a topic for another day. Navneet, we've had you for an hour. I don't want to go over time, but I would like to express my appreciation for your excellent presentation. It's a great privilege to have you as a member of the Sydney Southeast Asia Centre, and we really appreciate your research and your willingness to share it with our audience today. Thank you.
Thank you very much. Thank you. My
so
pleasure.
Much. And this presentation will be available on our Facebook page if you'd like to view it in the future as well. So thank you very much for joining us tonight.
Thank you. Thanks, Natalie. Thanks, everyone, for joining.